Welcome to Your Health Matters. I'm your host, Kayla Murphy. Today, we'll be making pork stir fry with Chef Joe. Chad Smith tells us how to stay motivated with a new workout program, and I interview Pam Pites about women's heart health. Now, news and announcements. Dr. John Caruso, a neurosurgeon at Parkway Neuroscience and Spine Institute and trauma surgeon at Meritus Medical Center, has received 2 awards in the past month. He's been named a super doc for the Washington, D.C. metropolitan area and, once again, one of the top 100 spine surgeons in America by the prestigious Becker's Hospital Review. The super doc designation comes from the Washington Post and is a result of evaluation by the super doctor's research staff. Dr. Larkin, who specializes in pain management at Parkway Neuroscience and Meritus Medical Center, was also named a super doc. This is the 8th year in a row that Dr. Caruso has been named one of the top 100 spine surgeons by Becker's Hospital Review.
We're innovative in how we take care of patients with minimally invasive platforms and with how we are delivering that care even in the hospital. We're heavily involved in promoting and strengthening the trauma program here at Meritus. And I think it's a reflection on what we've been doing for the last 6 years.
Emergency department doctors and nurses came out on the morning of Christmas Eve to lend a hand, joined by dozens of other hospital volunteers as they continued the 9-year tradition. The Lend a Hand project involved putting together holiday feasts for more than 2,500 people in the Washington County area. This year's event drew 100 volunteers, including ambulance crews, who delivered large quantities of meals to low-income senior citizen housing complexes. The ham and turkey dinners were prepared in the Meritus Medical Center kitchens and assembled in a large conference room at Robinwood Professional Center. The new year came with new places to park at Meritus Medical Center. More than 275 parking spaces were added to the hospital campus in the new parking lot behind the orange and silver parking areas. In addition, 28 handicapped spaces have been added near the main lobby and emergency entrances. The existing lots have been restriped to add more spaces for patients and visitors closer to the hospital, and enhanced directional signage and markers have been added to make it easier to recall where your vehicle is parked. Another 54 parking spaces will be coming in the spring near the blue entrance of Robinwood Professional Center. Now for announcements. Help your kids learn how to eat well and be physically active by enrolling in KidShape, a 6-week program offered for children between 6 and 15 years old and their families to learn how small changes in lifestyle can add up to big changes and healthy results. If your child's body mass index is in the 85th percentile or above and your family is interested in cooking demos, learning about healthy snacks, exercise, and other healthy lifestyle choices, consider registering for KidShape. The course begins February 2nd at 6 p.m. for orientation and continues through April 5th from 5:45 p.m. to 8 p.m. each Thursday at Elgin Station. The cost is $100, but scholarships are available. Call 301-790-8907 for more information and to register. It may perk you up to know that moderate amounts of chocolate eaten regularly can lower your blood pressure. If you want to learn more about heart health, be part of Meritus Health's Wear Red Day. Guests are encouraged to wear something red in honor of women's heart health at this February 16th event. The evening features a dinner by Dimensions Dining and Catering, including a cash wine bar, a chocolate fountain, and a heart-healthy marketplace. The dinner's keynote speaker, Dr. Payam Falahi, will discuss the benefits of red wine and chocolate in the talk, Not Everything That Is Good Is Bad. Registration is $25. To register, call 1-888-803-1518. January 17th was the first meeting of the all-new Parking Task Force. The task force, which is composed of Meritus Health employees and members of the community, is a forum for people to voice their concerns or suggestions about parking at Meritus Medical Center and Robinwood Professional Center. For more information, call me at 301-790-8826. And now, we'll talk with Dr. Salvagno about joint replacement surgery.
I'm Dr. Ralph Salvagno. I'm an orthopedic surgeon. I practice at the Center for Joint Surgery and Sports Medicine in Hagerstown and practicing out of Meritus Medical Center in Hagerstown. I've been an orthopedic surgeon for about 25 years, and since that time, I've seen a lot of evolution in the treatment of knees, and particularly arthritic knees, which is my patient population. People come in really for probably 2 different reasons. First is pain. The second is an impairment because they can't do what they need to do or want to do. It's been exciting, and there's been a big change. As time has gone on, we've seen patients who have had very good results with joint replacements, but in the past, we could offer very limited time that we would expect the knee replacement to function. But during the last 25 years, there's been tremendous advances in the design of the implants, in the metallurgy and the different types of materials that we use that have allowed us to now say we can maybe get 15 years, 20 years, 25 years. Of course, depending on your activity and your weight and what you're doing. So it's been a very exciting time, but it's also been a very challenging time because as that change has happened, we're seeing patients who are coming to look for the option of joint replacement, both much younger and also sometimes much older, as we're all living longer and living more healthy. I see patients generally from the ranges of about 30 to about 90. Most of the patients with arthritis of the hip and the knee. We do look at the x-rays, we put that together with your exam and your history, and then we can come up with a treatment plan. For many patients, particularly younger patients, joint replacement is really not the option at that time. There might be other options like braces, physical therapy, medications, injections, and what we see very commonly, weight loss, which can have a big impact on the joint. The other thing about joint replacement, it is a participatory exercise. It's not like going in and having surgery and you go home and you say, okay, I'm just going to wait to heal. You have to do exercises before, you have to do exercises afterwards. The technology has advanced to the point where we can make some predictions about what we think the outcome's going to be, and for the most part, they're relatively good. We can get people back so that their joints are moving, so that they're without the constant pain or impairment, that they can do things around their home, that they can play with their children and grandchildren, and sometimes play sports, particularly going back and playing golf, a little doubles tennis, things like that. That's really what our goal is. Our goal is to improve the quality of life.